Director for Youth Initiative Development Program. So we are delighted to have you here this afternoon. I know, sir, to some people it's morning, to some people it's evening, but today's discussion is going to be as interactive as possible because it is timely. We have a lot of mental illness amongst the youth. And today's topic is public-private partnership to tackle mental health crisis in Africa. So without wasting a lot of time, I'm going to invite the moderator for today, Ms. Liz Otai, to take us through. Liz, over to you.
So you're just checking in if you can hear me?
Yes.
Okay, perfect. I'm actually having a bit of a challenge with the Wi-Fi, but I will try my best. Just be on I'm trying to switch to my data. But ladies and gentlemen, good afternoon, good evening, wherever you're joining us from. As Collins just mentioned, yes, this is going to be super interactive because we're talking about mental health. And given the past pandemic, we've just seen what this actually means in terms of economy-wise and in terms of just trying to curb the pandemic itself. But we forgot this particular aspect, that for somebody to be healthy, it means it has to be from a holistical point of view. And that is the description that's been given by the World Health Organization. So we're looking at mental health, but from a niche of PPPs. Now, when we talk about PPPs, it's usually about funding and more partnerships and strategic partnership. But today we're going to look at what this means for the youth if their mental health is not in the right place. So ladies and gentlemen, my name is Ms. Lizzie Otai. I'm going to be your moderator for today. I will not bore you so much because we have key experts who understand what mental health in terms of the youth actually means and the role of PPP. But I'm hoping that by the end of this discussion, we'll also have good ideas, clear strategies going forward on how we can actually help the youth address mental health issues and also let them know that it's okay not to be okay, because that's the first step. So we'll just go to the next slide. Maybe a few house rules. You're always going to be on mute unless called upon to speak. So feel free to also use the Q&A, the reactions for you to raise your electronic hand, maybe also put in a thumbs up or something, depending on the comments that have already been shared. Use the chat to type in your questions, any comments, any reactions. You will be on mute as mentioned, and this session is running fully in English. We are recording. So if you would like the link to the recording, please request that to the admin and we can share that. We are hoping we'll run exactly 90 minutes. Depending on the discussions, we're going to try and keep time as much as possible. Just to reiterate that when you're making your comments on asking a question, please direct it to a specific speaker and make it as brief as possible. Yeah, those are just a few house rules before we kick off. So let's start the discussions on PPPs and mental health. Yeah, so just a bit of background, and I think this back to you, Collins, just to give a heads up on why IDP is doing this and why we're very passionate when it comes to youth and health in general.
Thank you so much, Liz. I hope you can hear me.
Loud and clear, yes.
Yes, just to take you through about who we are. Youth Initiative Development Program is a non-profit organization registered in Kenya with an aim to inspire and empower vulnerable young people through various programs, including training, community building, and also promoting youth engagement through volunteerism. And we have some number of interventions that we've stated there. That's poverty relief among the youth, sports, ICT, education, youth health, well-being, and stakeholder convening. As you are all aware of the situation of the youth today, we have a lot of mental illnesses among the youth, which is affecting the youth. And today's discussion is going to be very much important because we are going to narrow down some of these challenges and how we can work collaboratively to help the youth overcome these challenges in Africa. So here is the program for the day. I think you can just take a moment. You can take a photo of it or print screen, and then you familiarize with it. Some of the speakers that we have are very good speakers, and you are going to enjoy the session. Over to you, Liz.
Perfect. Thank you very much for that brief background on YIDP. And maybe just to emphasize, the work that YIDP does around youth is something that is very commendable. And we've seen this in the past meetings and calls that we've held with the 1.8 billion, and I like reiterating this number of youth and adolescents in the world. It's high time we start addressing their mental state. It's high time we start addressing health in general and look at the issues that are affecting them as a whole. So we'll just quickly kick off and start with a first keynote address. Maybe we go to the next slide. Great. So we're going to have a discussion, a power minute from one of our speakers, Isaac Mwibanda, and I'm hoping Isaac is on the call just to be on the side. Isaac, if you can unmute yourself, please do share some more information on what you think we can do or how we can tackle mental health issues in the continent with a specific focus on the youth. But this is just to push for the agenda of PPP also having this particular angle in their discussions. So over to you, Isaac.
Liz, Isaac seems to be having some technical problem. Maybe you can go to the next speaker. I'll let you know if he's in.
No worries. That's okay. This is expected. That's why we're in the technical era. Okay, so we're going to just keep Isaac for a few and just hear from. I'm assuming Yvonne is on the call, right? Perfect.
Yes, I am.
Yes, great. Perfect. Yvonne, as I was briefly just highlighting, it will be great to just get some feedback on what you think. So Yvonne is going to deliver a keynote address. And what I like is Yvonne is very kind of youth at heart, and she's a psychologist, so she has key expertise on what this actually means. So Yvonne, please, over to you.
Thank you very much, Lizzie. Good morning to from wherever you are. Good afternoon, good evening, I'm not sure. My name is Yvonne Amolo. I am a psychologist by profession, currently working at a rehab called Nairobi Place Addiction Treatment Center. Other than that, we also alliance with other youths and other organizations to try and create awareness on what mental health is, because matters of mental health are still very young in Kenya. That is the truth of the matter. And before I go any further into discussing the topic of today, I'd really like to give a highlight of what mental health is, so that as we are going on and whatever I'm saying, and in whatever I'm going to say, we're going to be in one page. So mental health, according to the WHO, is a state of mental well-being that enables people to cope with stresses of life. That is the component number one. Realize their abilities, component number two. Learn how to work well. That is component number three. And component number four is, other than that, they be productive members of their communities. So it is not just about absence of a disease. It has its own components as well. So, and I think some of us or most of us know about the common mental health problems that we have, or illnesses, depression being the leading cause of psychosocial disability right now. We have bipolar, schizophrenia, anxiety, substance use disorder, among so many others. There are over 200 in the DSM-5 as it is at the moment, but that is a topic for another day. And I would really like to appreciate the government of Kenya and the much it has been trying to do in terms of ensuring that mental health is acknowledged everywhere, though we still have a lot of things to do, considering that We are still ranked the 4th country leading with mental health disabilities in Africa and the 9th in the world. That is a very big number. That is approximately around 1.9 people suffering from mental health problems in the country at the moment. We have a few gaps, so many gaps actually, but I want to appreciate that where we are today is not where we were yesterday. And the first thing I would like to say, which is a bit simpler to understand, is that the language, for those of us in the mental health dockets, the language that we use is too hard for the common mwananchi or the common citizen to understand. So if you go to a youth and start saying you have schizophrenia, they will not understand what you're saying. So you find that we have our own local languages, and for the youths, mostly we use Kiswahili or Sheng. I don't know if that's a term that is known to some of us. So if you really want to be able to get to the youth in Kibera or Madare, you also have to have a language that is narrowing down to them so that they can be able to understand. It is not about showing them much, as a practitioner or as a mental health advocate, but rather being able to narrow down to them and also speak one language with them. So that is one of the challenges we are having. And I hope as we continue further, it's something that we're going to consider doing. We also sometimes we also have an issue with the number of practitioners we have in the clinical area. This is something that is even in the task force and also in the mental health policy of Kenya. They acknowledge that we have inadequate mental health practitioners to reach out to all these people. Considering I said it's 1.9 million people, and the task force we have is nothing close to the amount of cases we are supposed to have. So you find that where there's inadequacy in terms of human resource, the services we're going to offer are going to be substandard, not because we want to, but because we are being overwhelmed as a system, and there is a lot to be done, but little people to do that. So that is another challenge we're having. And also areas like Kibera, Madare, and many other areas, which we know that most of them are full of youths. As we know, youths make up the largest number of population in Kenya, cannot be able to access these facilities. It is a struggle we're still having, considering that in the 47 counties we have, we only have 15% of the counties equipped with psychiatric units. That is not even half of the whole counties that we have. So that's another challenge that we have. We might want to be able to even reach out to these youths, but the facilities we have are not enough. So I think even for the Kenyans we have in this platform right now, if you ask them about the mental health institutions they know, probably the one they will mention is Madare Mental Health Hospital. Other than that, you won't hear another one. But they are there. There are certain mental health institutions in the country, mostly owned by the private sectors, but then there is no proper interconnectedness between the public aspect of it and the private sector as well. So you might find that you might know someone who needs this help, but there is no proper linkage to how they can get to these services. If you go to Madara, you might find a situation whereby there are so many patients, but there is not enough room. But probably there is no way that the government can be able to reach out to these other many private sectors to be able to connect them to the right source. So that's another challenge that we have. And we also lack medical insurance. As we know, most of the Kenyans, we are unemployed, or if employed, we don't earn enough to be able to sustain treatments such as mental health issues. And considering that for some of the mental health issues we have, such as schizophrenia, the advanced version of it, or bipolar, or even advanced depression, you have to live under medication, and they're very expensive to buy. So if you don't have a medical cover, which most of the medical covers we have in the country only insure the physical aspect of it, you might find that people would want to seek for help. The people know about the mental issues they have. They would want to go there and seek for help, but can I really sustain the medication and the treatment process? It's a struggle that we have. And also, I think the other thing I would like to mention is the budget allocated for the mental health docket. It is 0.01 at the moment. That is still very low. considering that globally it is at it's supposed to be at 2%. We are not close to that. So if the government had a way to allocate more to the mental health dockets, we'd be able to make sure that we give quality service as the Amendment Act of 2020 requires of us, and also that these people receive only what is best, and also we are able to absorb the mental health practitioners that are graduating. Some people have graduated but they're not employed. So the other reason why we could have inadequate human resources, because there is no clear system of absorbing these people from when they finish school to these other institutions or the dockets that are there. So there are so many issues we are having, and every day we are making a step closer to what we envision as the highest attainable mental health as the WHO requires of us. But I think I'll stop at that for now, because this is a discussion I cannot be able to complete today. So thank you very much.
I actually didn't want you to stop because I was getting excited when you're mentioning all these statistics. And it seems like I just bumped into an article and they're saying the ratio of a psychiatrist to a patient in Kenya is actually 1 to 500,000. I don't know how legit that is, but these are alarming numbers. We really need to get to a place where we can at least meet the budget. I mean, 0.01 is still, we're way behind. And I like the fact that you brought that up. But also just a quick question before your turn. I need to apologize about the background noise. I'm at the airport. I just need to ask you real quick. We're talking about budget allocation, but we're also seeing that the World Health Organization and the member states are pushing for universal health coverage. And looks like this budget allocation just for mental health, even 2%, I don't see it being enough. So my question to you is, what about the youth who have notes accepted that they have mental health issues, they're having a challenge? How do we reach that population? I mean, for now, I'm pretty sure it's just the ones who walk into the facility or are being brought in by family, but we do have signs and symptoms that the youth can also look at, just to see that and accept that their notes in their rightful place, and it's okay, notes to be okay. How would you address that particular area?
Thank you very much. So in terms of that, I was reading somewhere and I saw a statistic that said that 5 out of 6 of these people that I've mentioned, the 1.9 million people, they do not get the mental health services they require, partly because of the cost, but others, they are not even courageous enough to go and seek for this help. As we know, mental health services and departments like psychiatry, psychology, social work, and all that. These are new dockets in Kenya. These are new professions in Kenya. They're still budding. We're also trying to come up with bodies for that. So being such, we still have to fight this never-ending stigma of associating mental health with a demonic attack to some people. To some other people, they think it is just a matter of exorcism and you will get these people well again. So there's a lot of stigma associated with that, which mainly is culturally embedded in us. And what we really do, from my own experience of being part of the people who are mental health champions, is we try and create this awareness. We do a lot of mental health walks. We also do a lot of seminars. We include, for the youths, we include mental health talks in other activities like games, dances, and all that. If you want to attract a youth, you must make it very entertaining and all that. So we come up with all these activities, hikings, and all that, to be able to talk about mental health. Like a part of it, we can just sacrifice an hour of the 4 hours of fun and decide, what, we are going to discuss anxiety today. How do you understand it? etc, etc. So these are the things we are doing. We're also doing a lot of volunteering work, especially in the schools, in adolescents, people. Mostly they don't get the psychiatric help they need. So it is up to us to go reach out to them and try to show them, what, it's okay not to be okay. We all struggle at a point, and what you're going through is this and this is what you can do. We also have, I think mostly those are the things we do among so many other things. We also do a lot of pro bono services when we can. And I think we are getting a step closer to where we want to be. We are trying to make the noise as loud as we can. Yes.
Thank you very much, Yvonne, for that. And just don't hang up, because I do know there's going to be a couple of questions. Ladies and gentlemen, welcome to today's session. Also, just feel free to just type in your question using the chat box. We will have a session for Q&A. I'm trying to see if Isaac is back. I think I saw Isaac on the call. Isaac, are you around? Maybe perhaps you can just unmute. Yes, perfect.
Yeah.
So Isaac, we were just having a discussion with Yvonne, and today's topic is about PPPs, but we're looking at the youth and mental health. So it will be good for you to also just chime in from your own expertise and perspective on what this actually means and how can we curb this in the continent. Over to you, Isaac. I think you might have to go back to Isaac's photo, please. Whoever is showing, let's just go back to Isaac's slide so that we don't get the speakers confused. Sorry, yeah, Isaac, over to you. Thank you.
Thank you, and apologies for logging in late. I had hiccups in trying to log in, but finally I'm here. Good afternoon, everybody. Good afternoon, everybody. I thank the organizers for this wonderful thing. Just to briefly introduce myself, then I'll quickly chip in on what the previous speakers said. I'm Isaac Mwibanda. I started doing drugs when I was age 14, all the way to age 31 when I quit. And so it was peer pressure. Then later when I got fired from my workplace, I used to work for Firestone in Nairobi, Kenya. Then I got into depression. I got into suicidal tendencies. Then I sank deeper into addiction. I started drinking jet fuel and other illicit stuff. And so I really understand what mental health and addiction is all about. And even in Kenya, we just recently started a platform called Mental Health Convo, Mental Health Conversation 254, which is the area code for Kenya. And we've been engaging, and we've really been hoping and praying that such platforms come up so that people can freely engage in this thing. Because as you say, mental health really worrying. I've also been going through a lot of statistics and through what I'm engaging in. And just to correct the statistics, I'm in touch with a psychiatrist from Bungoma, Dr. Isaac Isiangan, who is our lead consultant in Mental Health Convo. And I was sharing with him the other day, and he said, in fact, there are about 100 psychiatrists in Kenya. So that's the ratio of 1 to 1,000,000. And most of them are based in Nairobi and Eldoret and other urban centers. So in the rural is worse. So just to correct that. And to add on the mental health bill that was passed last year, was it last 2022? I'm not even sure if it is operational in the first place, because to add on to what the previous speaker was saying, if you go to mental hospitals, I think you can equate them to prisons in Kenya. They are in a very deplorable state. And in fact, even most of the people who need mental health services shy away from attending such facilities, because you are like considered to be a mad person. In fact, we should start at the point that in Kenya, when you have mental health, you are considered to be a mad person. So there's a lot of stigma in terms of mental health. And in fact, even most of the people, I was reading another statistic from the research that was conducted in Kenyatta National Hospital and Moi Hospital. A lot of the patients who walk in there don't even know that they go there with other cases, but they are found out to be suffering from mental health. So even most of us, even in this forum right here, we may be suffering from mental health, but we don't know. So maybe for now, if I can stop there, if you want, I can also highlight some of the issues of the PPPs, if I'm allowed to.
Yes, please. I mean, today's discussion is all around PPPs and how we can actually use that particular collaborative angle to address the youth mental health issues in the continent. So yes, I can add you 2 more minutes and just touching on those before we proceed.
Thank you very much. And just like in Kenya, we are having PPPs in terms of infrastructures where we are having multi-billion projects, road projects, expressways. I think the mental health, just like the previous speaker said, just the health sector itself is getting a very little money. So if a lot of funding can be done to improve of the mental health facilities in the country, I think that can be a very good thing. And then even rehabs in Kenya are very expensive, the private ones. So a lot of people can't access the rehab centers to get quality rehab services. So the private sector can come in and help fund more to train more psychiatrists, and then even to improve medical facilities for such. And then there was the public participation. There was the former parliament. There's a senator who was called Senator Sylvia Kasanga. She proposed a bill, but not followed up to know how far it has reached, to decriminalize mental health. Nowadays in Kenya, if you attempt to commit suicide, you end up in jail instead of a mental facility to get help. So I think if we can also follow up on that we can decriminalize suicide. In fact, Dr. Kisiangani was telling me, in fact, it has come a time where we should say somebody died by suicide, not somebody committed suicide. For me, that was so profound. And I think this is a conversation we can begin from now, that at least people who are suffering from such cases, and in Kenya lately, there's a lot of suicides and homicides because of people are depressed and they end up killing each other. So if we can arrest the situation and invest in such, and then follow up on this suicide, because I'm informed that I don't know if we have any participant from Ghana, that Ghana is the only country in Africa that has decriminalized this suicide. So that's something that we can also follow up on. And I think for now,
thank you, Isaac.
Yes, thank you.
Thank you very much. And I like what I like, especially from Yvonne and yourself, is the actual things that are happening on ground and the statistics that are out there that we might think we know, but we actually do not know, especially the ratio of a psychiatrist to the population, it going to 1 million now. That is just crazy. And also just knowing that the 100 that we have are concentrated in different counties. So how do we spread this? And that's where we're calling out for PPPs. How do we train more of them? How do we spread the already existing, mental health experts that we have in the country, so that at least all the other counties to have that service being provided? But I also like the fact that you've said it's time we decriminalize this. We were talking about it being okay, not being okay, but a lot of people also do not know when they're not okay. So when I try to commit suicide, it's not me doing it just because I want to. Maybe I didn't even know I'm going through depression itself. So I like the fact that you've highlighted this. And please don't drop off the call, because I know there are lots of questions that's going to come later on. So ladies and gentlemen, welcome. We're talking about private-public partnerships to tackle the youth mental health crisis in Africa. We just had our first speaker, Yvonne, speak. We just finished hearing Isaac's thoughts on this. And now we're going to move completely to a different part altogether. And we're calling upon Magata caller. Magata, if you're on the call, maybe you can just unmute yourself, introduce yourself, and please let us have your 2 cents on this discussion that is happening today. Magata,
Good
over to you.
afternoon. Yes,
Good
thank you so much. Good afternoon. I'm hoping everyone can hear me.
Yes, loud and clear.
That's perfect. My name is Mahata. I'm the training lead under Youth South Africa, currently in South Africa. Yes. Okay. So on this topic of mental health, that's something that is related to me, if I should put it like that, or is something that speaks to me on a daily basis, because we are working with young people, and as one of the people that were looking for opportunities at some point, I believe that I can say that looking for an opportunity is draining at the end of the day. So currently we know that South Africa or any African countries, young people are struggling in terms of looking for opportunities. So as Youth South Africa, or should I say as training and development, the main aim at the end of the day is try to ensure that our youth, when they come into the program, now they are ready to be able to face any challenge that they face at the end of the day. Because the most important thing, we are looking for opportunities. How do you cope when you know very well that you're the breadwinner, you don't have a mother, you don't have a father, but how do you cope in that space? So as someone who's been in the marketing space, especially before YHA, for more than 10 years, without knowing on how to help my mother when my mom, she's single. So you can understand the space itself where you don't even know how to actually come out of that situation. So being part of training and development today, it actually helps me to be able to voice to everyone that, you know what, it is possible for you to speak to someone. So the most important thing that young people are actually facing currently in South Africa or in the world is youth unemployment. And the other thing is that young people that they don't actually know how to cope with stress, because you don't know what to eat tomorrow. You don't know how to tackle that. So as YHA, how we try to assist young people is that we provide trainings, and such trainings we try to remind them about the importance of talking to someone. It doesn't really have to be your friend, it doesn't have to be your family member, but the most important thing, you really need to speak to someone who can be able to listen to you. Remember, the other thing that I don't know if I should put like as Africans, we only understand when we say someone is sick, when you can actually physically say that Lizzie, for example, she's sick. But when we talk about mental health, it's something that it goes with emotions. No one can actually see until something happens tomorrow, or until something triggers you. That's when we start to understand that, you know what, this person was actually suffering from mental health. So talking about mental health as young as we are is very, very critical at this point, because as young people, we look like how the social space is emerging at this point. We look at how people on the other side are actually enjoying life. But how do you know that these people are actually enjoying life? Because that's the first thing that happens, because it starts from the mental space. So that's why I go back to the importance of communication, the importance of aiming, the importance of understanding that mental health is something that we really need to to consider moving forward. Because at the end of the day, as I mentioned, that it's not something that you can actually see, but that's something that the next person actually suffering from, for example. And yeah, let's just look at how men in South Africa, or men in the country, the way raised, that men are not allowed to share emotions. That is, at the end of the day, they break down. So as YHA, as an organization, we come back again, we say that it's time for you to speak out. It's time for you to speak out, and so that we can be able to resolve such issues, so that by the time they leave the program, because our programs are only for 12 months. What happens after 12 months? Now you're earning a stipend today. What happens to you after 12 months? So that's something that we really need to prepare you by the time you leave the programs. Now you need to understand that, you know what, now I'm out of an opportunity. How do I move around not having opportunities, let's say for more than 3 months or 6 months moving forward, because at the end of the day, I'm the breadwinner. How do I tackle that? So most of the times I just love talking about myself, because that's something that I really understand myself. So I'm someone who was raised by a single mom. So imagine a situation where your mom, she's a domestic worker. Now you don't even know how to eat, how to dress up, how to be happy at the end of the day. So that's why it comes back to the importance that it is really, really, really important that we are having this type of discussion, that young people, they can actually understand that, you know what, there's no harm in talking to someone, you know, there's no harm in talking to someone. It can be a stranger, it can be anyone at the taxi rank, but the most important thing is that speak out and let people understand how you feel. Let people understand what we can do to help. As an organization, we've partnered with SIGHT. SIGHT, obviously, like currently is working, it's only assisting us employees. But the most important thing that I wish one day is that it can be able to accommodate our like 40,000 or 50,000 interns out there, so that by the time they feel overwhelmed, because as young as we are, we feel overwhelmed sometimes, they can be able to speak out and be able to get help. So that's my say. Thank you so much.
Thank you very much. And I appreciate all the thoughts you've actually brought into this conversation, because we also see that apart from youth, we also have key populations where the youth fall under. And of course, they already have stigma about their own self. Now there's that whole depression, and they can't even talk about it, because you know how it is when it comes to key populations. This is a very sensitive topic across the continent. So thank you very much for bringing that. And I like what you've reiterated. Please communicate, learn how to speak. And as ENASO, we also just realize the power of communities and how we can tap into communities. I mean, they know what's going on ground. They know who's not well, what's happening. And I know when the Kenyan speakers were mentioning that there are a lot of homicides being reported. You see youth committing suicide. You see youth, stabbing their lovers out of quarrels because they didn't even know they're in that particular state. And there's so many things that we can do. So just a quick question to you, Magata. We're talking about PPPs, and you've highlighted that there are already 12-month programs that people go through. And we're trying to see how can PPPs tap into elevating all these efforts that have already been put in place by the private sector, so that it helps tap into, we're trying to achieve universal health coverage by 2030. But we already have other commitments and other programs in place that can help elevate the situation that we're in terms of mental health. So from your own perspective, from the South African lens, how can we tap into what communities, private sector organizations are doing? And there's just a miss, like it could be maybe these programs are not legally being acknowledged by the public space. It needs to just have, the governments and private sector sitting down and saying, we've been doing this on a community level. It's been working. We've rehabilitated X number of youth. All we need is your support, hold our hands and elevate this to a national level, which can also assist in the gaps that we're facing. What would be your thoughts around that?
Okay, so thank you so much for the question. So the most important thing currently in South Africa, what I can say is that, or should I say around the world, the only issue that I'm just going to continue repeating it is around the stigma, is that people, they really don't believe this mental issues. When you bring them up, it's like you're talking about something they don't even understand or something they don't even feel, because they'll always tell you that, there's no way that you have to express your feelings to a stranger. But the most important thing we need to understand that, or our government, what they need to do at this point, I know that they should understand the importance of commemorating the importance of mental health on a daily basis. It shouldn't be something that we only talk about it on a specific day. It should be communication that, on a single day, people are dying, people are depressed on a single day. Why should we have this conversation only on that specific day? So I believe that it should be something that is being communicated, because we're going through a lot. We're going through a lot, and no one knows what you are going through at the end of the day. But the most important thing, in closing, what I can say is that, can we have this conversation every single day, so that even if we really have to bring it back to the education space, can it be like that? So thank you so much.
Thank you for highlighting that, bringing it back to the educational state. Let's incorporate this in already existing systems. So thank you very much, Magata, for that. Ladies and gentlemen, we've moved from Kenya, we've gone to South Africa. Now we're taking it back to, to Tanzania. Dr. Raymond, he's very passionate about youth, but he's also very passionate when it comes to mental health issues. So Dr. Raymond, over to you.
Okay, greetings everyone.
Hello.
I hope, yeah, my voice is heard.
Yes, loud and clear.
Okay, thanks so much for joining this very important topic, how the public and the private can partner to tackle the crisis in mental health, especially to the youth group. My name is Raymond Nusura Mgeni, a medical officer from Mbeya Zonal Referral Hospital. This hospital serves to almost 8 regions to the southern part of Tanzania. And also I'm doing mental health advocacy through newspapers, adding content in radio, in Tanzania, even outside Tanzania, with the rest of America on the part of the mental health awareness. This topic is very important, especially I will talk more about the line of mental health advocates, because most of the part of our societies are lagging behind in terms of education about mental health and mental illness. So the part of advocacy is very important to join hands both from public to private, so as we can help the group that is youth that are all at the very risky group among the population, because at the time of the youth age, most of them, they are getting into use of substance, others get problems in terms of depression, but also the issue of social media current as being the more problem, especially to the youth group, social media addiction. So the part of advocacy is very important to the first to the public and also the private. To the part of the public, here we are addressing more on the part of how the government play part to the public, the mass media, social media, but all the private, this is all part who are creating more mental initiatives in terms of advocacy, so as to address in terms of education, training, seminars, workshop that are addressing about mental health and mental illness. At the part of this, we in tackling this problem to especially to the youth group, I think that is very important to is insisting more on the engagement from the both parts. Taking example in last year in Tanzania, it was the first time that we have conducted a national dialogue about mental health. It was the first time for Tanzania to do this. This is a very nice initiative that can be done to other countries or can be done to other places in the world, because it addresses more issues about mental health and what to do as the part of the public or the part of the government. But also have been increasing more of mental health advocates through social media that are addressing more issues on mental health tips, on mental illness symptoms, so they, as a community, can get aware about what is mental illness and the part of the mental health. And part is that is very important is to addressing the importance of introducing the mental health awareness to the schools, especially schools from primary, secondary, because this is the very targeted group that if we can equip with the awareness of the mental health at the early stage, it can help a lot to tackle the crisis that can be happening if we fail to do anything now at the early stage. So I think on the part of curriculum, we need to introduce this part of the mental health awareness to the targeted group, especially from primary, secondary, even the college. But another on tackling on this mental crisis, on the part of social media and the part of radios, newspapers, we need to address more topics, even the news about mental health. Sometimes there is a case that has possibly maybe suicide, and sometimes because the communities always have the long belief about mental illness, and most of them they are thinking maybe the person have been possessed with the demons. So sometimes this can hinder to the part of treatment because of the long beliefs. So I think that as a part of newspapers, radios, TVs, we need to address more the correct information about mental health so as we can even reduce the stigma that is always the problem in our society. So I think mostly on the tackling of this, we need to increase more effort on the part of mental health advocacy.
Thank you very much, Doc. And just one quick question before, I kind of move to the next speaker. We're talking about culture, which is something that a lot of people are not actually paying attention to. And we're coming from an African perspective where, going mad literally is not something we can easily identify. It could be depression, but we'll already tag you as a mad person, and that is it. And we also know there's some cultures where a man, as Magata mentioned, you are not allowed to start saying you're having depression, you're having issues, you're the breadwinner. So you need to, keep everything inside and make sure you provide for your family. But you've brought out something that also Magat touched on, and this is incorporating mental health into the curriculum, all the way from the primary level to the university. What would be your inputs on this? How can these departments, and this is the Ministry of Health, Ministry of Education, work together with the private sector? It could be the private sector is bringing up maybe the financial assistance, but how can that work? How would that incorporation look like in the curriculum system, especially in Tanzania?
Okay, on this part, we need to partner with this is we can say that we can do like, we can connect all the ministries from the Ministry of Health, the Ministry of Education, so that because the Ministry of Education is mainly to structures curriculum. So we need to talk with the part of the Ministry of Health and the Ministry of Education, even the private sectors, because some schools are owned with private sectors. So we need to cooperate together so as we can come with the one thing that if we want to introduce this curriculum, we can join hands together from the Ministry of Health, the Ministry of Education, private sectors, even the financing part, because also it needs finance to finance all this on the part of curriculum, in terms of the trainers, in terms of the tools. So the part of finance, the part of finance is also very important on helping this to come into reality. Thank you.
Thank you very much. Asante sana daktari. Mimi niko Julius Nyerere, yani najaribu kutumia Wi-Fi ya airport. But thank you very much for just highlighting and chiming in. Ladies and gentlemen, we're going to our next keynote. And just to reiterate, this is a roundtable discussion. You know how roundtables work in the African context. If you have any comment, input, if you differ with something that somebody has said, you're allowed to chime in. So I would like to just repeat that you can go on and use your electronic hand, and of course we will call out to you and you can comment. Now we save the best for last before we start officially our discussions. So I'm going to call upon Shreya. I hope I'm pronouncing it right. I tend to butcher people's names, I don't know why, but over to you. Give us your own thoughts around today's topic, especially how PPP can now be coiled around youth and mental health issues in the continent. I mean, private sector already knew this is an issue, but the way the doc has just mentioned, Tanzania has recently just acknowledged that this is a big discussion that needs to be at the table. So over to you, Shreya.
Thank you so much. So hi, everyone. First off, thank you so much, Mr. Collins and YIDP for this wonderful speaking opportunity. I'm Shreya Venkat, 20-year-old rising fourth-year student at Georgetown University in Washington, D.C. in the United States, currently pursuing an accelerated master's degree in global health at Georgetown as well, with an aim of delving into a career within health policy. I'm also the founder and CEO of the nonprofit Nest for Us, which was formed as a philanthropic platform built upon kindness, generosity, and social good. And what began as a small project 7 years ago is now a multifaceted global organization fueled by over 6,000 volunteers who altogether have contributed over $3 million in value of volunteer hours, impacting tens of thousands in over 30 countries across 6 continents, with the support of manifold public-private partnerships at all levels, so the local, national, and global level. At Nest for Us, we not only supply essential resources such as nutritious meals, blessing bags, containing toiletries and PPE and academic materials, but also societal awareness through interactive workshops and social media engagement to spur words into action. But most importantly, we foster a sense of community fueled by love and compassion, by providing an overarching support system for each and every individual we come across. This dual approach of awareness plus action enables us to fulfill our vision of empowering people of all demographics to create a more inclusive world for everyone, everywhere. Today, I wanted to bring to the forefront of the conversation the critical necessity of prioritizing mental health and healthcare reform and how public-private partnerships can support this invaluable goal. In order to supply relevant and accurate counseling to members of the community, health workforce and governance implications do exist. With the lack of specialized health personnel as a result of brain drain, which is a common phenomenon, especially within the African continent, placing a disproportionate burden on community health workers and volunteers who are supplying this healthcare to the community. Moreover, a heightened push for prioritization of health policy reforms within the national agenda, while beneficial in theory, have yielded adverse effects due to inadequate time, people, and resources to effectively introduce each of these proposed interventions in a sustainable manner within community frameworks, further highlighting widening fragmentations between the national and county level governing bodies. Additionally, a contributing factor to this trend is the increasing rate of burnout among medical staff, which deter young people from pursuing medical studies and remaining within the country to supply equitable, safe, and long-standing care to national citizens, leading to movement abroad where incentives such as higher compensation, advanced technology, and safer working conditions, both physically and mentally, exist. Furthermore, when it comes to community-based mental health initiatives, they must be person-centric, holistically designed, and culturally salient. Just because one intervention helps solve an issue in one area does not necessarily mean it will address the issue at hand to the same capacity. Think of it like this. You can't fit a square puzzle piece into a circle-shaped hole. Likewise, if, for example, one attempts to implement a biomedically rooted intervention within a community that relies greatly on traditional healers or more unconventional methods of health for medical support, it won't be as effective and outcomes will seldom improve, which disrupts the optimal growth and development of young people starting from early childhood and leading into their adulthood years. Through my philanthropic work, I work to promote mental health destigmatization, encourage vulnerability, transform outdated narratives, and spread awareness of accessible mental health resources across various mediums, with the support of a wide array of multi-sectoral public-private partnerships. And I'd be delighted to connect with you all here in order to help prioritize youth voices in mental health advocacy and healthcare reform, as you all have, all the speakers today have eloquently put the needs as well as the potential solutions that we can all implement to improve mental health conditions, both in Africa as well as across the world. And with grassroots work, the beauty is that the power lies in the people, which means specific community needs are better understood and subsequently addressed, saving time, money, and resources while still providing the most comprehensive and equitable care possible. Moreover, over the years, I've realized it's dangerously easy to slip into a hustle culture's toxic grasp if you don't prioritize your own mental health. After all, you can't help other people if you're not taking care of yourself first. So it's definitely important to try and incorporate self-care as a central aspect of your daily routine, especially when you're advocating it for those within your community. After all, we can't underestimate the power of a little me time and the energizing feeling you'll get when you take a second to reflect on your own health and well-being and show yourself some much deserved love. thank you so much again for this wonderful platform. I learned a lot from the speakers, and I hope to connect with you all in the future to keep advancing mental health and make mental health not just a one-time thing, but a lifestyle. Thank you.
Thank you very much, Shreya. And what I like is the youth energy that you have. So this is very relevant, talking about youth mental health state and just seeing what the youth are actually doing. I've seen Isaac's hand up, but Isaac, before I call upon you, just a quick one, Shreya. I know you've mentioned that there's some issues with kind of how do I put it? Healthcare professionals are facing within the continent perspective, which actually makes them move to, other developed countries just to seek work opportunities there. And I know you've mentioned brain drain, burnout, the low compensation. From your own point of view, what would you think would be some of the remedies for this kind of issues? And we are discussing this, and we've seen a lot of nurses now moving from the African continent to other countries. What would be your two thoughts on this?
Yeah, so I mean, in terms of steps that I feel like both those in the African continent can take, as well as frameworks all across the world, is implementing structured breaks within, if we're talking simply about health, implementing specific breaks as structured shifts for healthcare workers, because I think that is one of the biggest deterrents from keeping people within the country. And so that will also help improve health outcomes and service delivery at the same time, making it more effective. I would also say greater investments in either biomedical treatments like therapy or medication, or more community-based interventions like community support groups. I know there's a concept called like nurse support groups, and so they could all come together and sit down and talk about, perhaps the stresses that they're having, and work together to find, these open forums, develop these open forums, co-create. I think that's important. Co-create these open forums to share, their feelings, their stresses, their vulnerabilities. And I think that will definitely help to improve and help decrease the rates of, illnesses like anxiety, depression, and different things like that. So I think those two can definitely be integrated relatively easily within community frameworks. But I think the most important thing, just looking comprehensively, is ensuring that community members are part of these discussions of what specific interventions are put in place, because oftentimes, especially with mental health, it's seen mostly as a Western concept. So if you have foreign entities coming in and trying to push certain types of interventions that have worked in other countries, but might not necessarily work in, perhaps rural Tanzania, or, in Kenya, but it's a completely different type of city than perhaps New York City, And so I think it is really important to be able to, have focus groups with the community, go out and do field research, hear directly from the community how mental health is perceived, so that appropriately interventions can be placed in order to effectively shift the conversation and shift the narrative. So thank you so much. That's a wonderful question.
I like the fact that you're bringing out this particular idea of incorporating the systems that are already working. Like culture also was mentioned as a big issue, and mental health also. It does look like a foreign, ideology, etc. But using the communities, really, that's a game changer, and we saw that during the pandemic. Ladies and gentlemen, we're just opening Q&A. My apologies, we can go on this discussion forever. But Isaac, over to you. I've seen your hand up.
Yeah, thank you. The previous speaker, I just have two issues I want you to clarify or address. In the US, there's a lot of mass shooting that has been, that people have referred to it. Mental health is the cause of it. Is it true? And number two, the post-war disorder for the soldiers. What is the situation now? And the last one, there was a video that was trending on social media. I don't know if it is true. There's a hotel suite that was in the US that you pay and you go and kill yourself. Is it true? And does it mean that that level of mental health in the US, with all the doctors and all the best facilities, you still are not coping well with mental health? Thank you.
Yes, no, those are all really great questions, and very sobering questions, because unfortunately, those continuously happen, and it's actually created, beyond just being a source of all of these violent acts, both to oneself, but also to innocent bystanders. It has also created this vicious cycle of numbness, where the community is not able to register the fact that these are each individuals that are being affected. We see simply a number, a statistic, and move on because it becomes a headline, stays as a headline for 1 or 2 days, and then passes by and we don't think about it again, instead of thinking as these numbers as individuals. So I think that is one of the problems, is just this numbness that unfortunately we as a society continue to feel. With the rates of suicide, yes, that is a common practice, to rent out a hotel room. We recently had, I think, there was a celebrity who did that too, but of course, individuals across the community do it quite often, but it's those who are famous who end up on the news. But that is a common practice as well. And I think one of the driving factors for this is the increased use of medication, not prescription wise, it's the overdose aspect of it. And so that is a very increasing problem within particularly the North American region. And that is simply due to the accessibility of these medications and these services. And so, yeah, it's a definitely a difficult problem to address, because there are so many layers to it. There's political factors involved, there are social factors involved, there are cultural factors involved. Especially if we're looking at the United States, there are so many cultures, people from all different backgrounds coming in, and so that they have different perspectives on what mental health looks like and how much is too much. And so I think having all these conflict each other is currently creating a landscape where it's difficult to come together and prioritize kind of like a set of standardized regulations to prevent these terrible acts from happening. So as of now, I don't know how we can move forward completely, but I do think one thing that has to be done is increased conversation about how each of these acts involve individual people, and kind of need to humanize these acts of violence in order to effectively grasp that these should not be happening and that these are preventable. And so once that is registered, I think we can move forward as a society to try to figure out how we can prevent this and have a more proactive approach to stop this from happening in the long run. Great questions. Thank you.
Also, just to add on that, I know Isaac mentioned the states having a lot of mental health care, givers, but we've noticed also in Kenya that, and there's this rise where we forget that healthcare professionals are also human beings, and they also have their own mental health issues, depression, etc. And we've seen there's a whole load of healthcare professionals who are coming together just to also say, okay, we're doctors, we're nurses, but we also there's a time we will not be okay, and we also need these services for ourselves. So there's also that case of us forgetting that the healthcare professionals are human beings. They also go through mental health issues, just regular citizens do. But as ladies and gentlemen, I mentioned, we are actually just discussing PPPs. This is a private-public partnerships, and how we can use that particular, angle of partnerships that has been there within the health space to foster, other helpful relations when it comes to mental health, and how we can curb that with a special focus on the youth within the African continent. I've just seen Elizabeth Mutuku introduce yourself. I'm sorry. The reason why we get you to introduce yourself is so that we know who else is in the room. And Elizabeth, yeah, thank you. Your hand is up. I was going to call upon you. It will be good just to hear from your own perspective. And you being a psychologist, I'm pretty sure you have 2 or 3 things to add into this discussion. So over to you, Elizabeth.
Okay, thank you for your invites. I'm Elizabeth Mutuku. I'm a psychologist. I'm a founder of Women and Children Against Violence. It's a CBO. I'm currently working at
I'm not so sure whether it's my
Defense.
connectivity or yours, Elizabeth. Do you mind having your video off? It could be your connection is being affected because of.
Oh,
Collins, just counter confirm you can hear me.
yeah, I can hear.
Yes, I think, yeah, yes, please carry on. Now it's a bit better. If you have your video off, it could be much more clearer.
I'm unable to put my video on. I don't know why.
Okay, just carry on. We can hear you now.
Yeah, so my name is Elizabeth Mutuku. I'm a psychologist currently working at the Ministry of Defense in Kenya. And I'm also a founder of Women and Children Against Violence. Concerning this topic today, we have a mental health crisis, even here in Kenya. We can see there are a lot of gender-based violence cases every now and then. Most of those cases, if you maybe look at the root causes, it's because there's a lot of trauma. People have not dealt with their past issues. Yeah, and also maybe like sexual violence. Yeah, and also among the healthcare workers, most of maybe us professional psychologists, there are very few of us who are trained as supervisors. We are supposed to go for supervision like every month so that we can deal with the issues of the clients and also our own issues. So we find like most of the workers, most of the organizations, they don't provide maybe support for supervision. Hence, you'll hear maybe someone is a psychologist and he or she has committed a crime. But if you look at the root cause, it's because that person has not been going for supervision. Also, we need to have, for PPPs, we need also to have trainings around psychological first aid, where the youths and also the population in general, they need to be trained. How do you handle people in case of crisis? What do you do as a PFA provider? And also they need to be trained the trauma management. How do you manage your traumas, your past traumas, your childhood traumas, which most of us are working with? We have the scars, some of us have wounds that we've not dealt with. So some of these are the root causes of the mental health crisis. And also we have the drug issue, especially here in Kenya. If you look at the news, maybe the deputy president and also the wife, they're complaining a lot on alcohol abuse and also other drugs. Those are major root causes of the drug-induced psychosis, the mental health problems. So we also need to have a lot of trainings around that area of drug and substance abuse. And also as psychologists and also as organization, they need to employ a lot of psychologists. Like where I'm stationed, we are very few, but we have so many clients. It's kind of overwhelming, where if we have many psychologists, both in the private and the public sector, people will be screened early, and hence it will be easier to manage maybe the treatment of the mental health disorders. And also another issue is engaging the counselors, even maybe during like recruitment of jobs. We need to have psychologists in those panels so that they can screen these issues. Yeah, so that we can also avoid crises in the workplaces, and also have psychologists in committees, like in school committees, they need to be there. Yeah, so that they can screen these issues also. And also we need to have education and awareness. This involves like trainings around the mental health mental health. There is also a lot of stigma around mental health. Most people, they don't seek counseling services. It's because of stigma. And we have this saying in psychology where it's okay not to be okay. So we need to educate the population that seeking mental health like treatment, it's normal. It needs to be normalized. And this can be done through celebration of mental health, especially in October. Right now it's May. We also have mental health month, and also it can be done through walks. Yeah, so it needs to be normalized.
Yeah, for sure. Thank you very much. I knew you had killer points and I was going to call you just to say a few words. And I understand and I totally agree. It's time we now move from all these discussions, and they need to have mental health experts while they're talking about budgets for mental health, while they're talking about partnerships for mental health. I mean, 100 psychiatrists in a country that has over 47 million is just not being realistic. I've seen Agatha Mganga on the call also. Agatha, I know you've introduced yourself as a counselor intern. If you're comfortable, it will be good for also if we can also hear from you, just a few words on your thought about these discussions. And I know Elizabeth just gave us a little bit of what needs to be done. What are your thoughts on this, Agatha? I'm hoping Agatha is still on the call. Collins, I don't know whether she's dropped off. Agatha, can you hear us? But no worries. So we'll just go back. Please feel free to use the electronic hand, type in your question, etc. But I'd like to call the speakers who just gave the keynote address. Yvonne, when we talk about solutions, we only have 15 minutes. But if we're looking at solutions, what would be your first 3 solutions that need to be worked on as soon as possible?
Thank you for the opportunity. First and foremost, one thing we always say when it comes to mental health treatment is that it is a diverse, multifaceted way or approach, where you cannot say that one particular aspect is going to work for everyone, like Shreya had said earlier on. And I think one of the key things we need to do is to be able to alliance with people even from the community-based areas. You know, as a psychologist, we also train psychosocial supporters. We also have faith-based support, and we also have community-based support. So if we could be able to create a link whereby before someone is referred to a mental health institution, there's some level of support they've received before then, because it is not in every situation you get a case that they need to be admitted for that. Even I think all of us, we play a part in the mental health aspect of it, because that moment that your friend comes and tells you, you know, I'm feeling like this and this, and then you guys talk, and by the end of the conversation, this person is feeling better. You have offered psychosocial support. So I think we need to have a clear link whereby probably if it is a situation that has been addressed or spotted in the church, a pastor can be able to reach out to a psychologist somewhere. I remember one time there's this youth pastor that was trying so hard to get a psychologist and couldn't get any, because there's no proper linkage between the community, the faith-based therapy, and now the clinical aspect of it. So if we could get that proper linkage from the bottom of the pyramid, we call them mental health psychosocial pyramid, from the bottom part all the way to the up there, that one could go a long way to help. Because as we've seen, there are so many cases. We will not be able to handle all of them as medical practitioners. We are not enough. But the little you can do is offer a bit of support, then refer to the next person. So I think, but even for us to be able to do that, we need to create a lot of awareness. You know, most of us don't have this tendency of referring someone to where they need help when something is bigger than us. Oh, sorry. You
Yes, they do just endure it. Yeah.
Yeah, you know, enjoy your problems. It is going to be okay. Just pray. But if the pastor or even the pastors knew that some issues, apart from now the faith-based help, they also need a medical aspect of it, they would probably refer, because the church is a good place to spot these issues. most people keep on seeking this help from the churches. We need when faith only is not helping. I'm not saying it's a bad thing, but we need to incorporate all these multifaceted approaches. So I think that would work.
Thank you, Yvonne. Thank you, Yvonne, for those inputs. I'm just going to call upon Isaac. What are your thoughts? I know we only have like 11 minutes to go, so make it brief and short. We're looking at solutions. What would be your first 3 solutions? Isaac, over to you.
Thank you. Before that, I'll be very brief. One, just to add on what the previous speaker said. Also, I'm heading an organization in Kenya called Life Challenge Kenya. We are offering certified biblical addiction counseling. So just to empower churches to have an idea on what addiction and mental health is. And number 2, I just want to run over some statistics briefly, then I'll just give 1 or 2 solutions. According to the 2021 UNICEF report, it says that 50% of the children are battling depression. 50% of the children are battling depression. And this is to echo on what the doctor from Tanzania, you'll forgive me, I'm not good in names, it takes me some time. He said about doing the curriculum from primary school. So this is something that should worry us, that if 50% of the children are going through depression, so we should really start tackling this thing at an tender age. Number 2, there's a research that says from the US that electronic addiction now is at 51% worldwide. So this is something also that should worry us. And then I'll do some statistics on suicide. There's some suicide rate. In Kenya, it says the crude average national suicide death rate is estimated at 6.1 per 100 people. That is about 3 to 1 in male and female. That you can get that from the Ongeri report of 2021. Another statistic said that 421 suicide cases are reported annually in Kenya. Those are the reported one. And then the global statistic is 1 person in every 40 seconds globally commits suicide. So these statistics should worry us and should really make us fold our sleeves and really try and do something about it. And then now just to finish on my solution, in Kenya especially, sorry?
We only have 9 minutes, so maybe you can make it as brief so that we can get input from the other 2 schools. Thanks.
Yes, I'm finishing on this. We should have a national policy where mental health should be declared a national disaster, and we can have mental health cases just like HIV, malaria, and TB, which are free in government hospitals, that mental health cases should be treated free of charge. Thank you.
Thank you very much. And it will be good to also just clarify. Hello, sorry, I was Albert, over to you. Albert,
yes,
you've just unmuted yourself.
Yes, I'm sorry. I just felt the session cannot end without me mentioning something I think is very key.
Yeah. Over to you, Albert. Yes.
I think for me, the conversations we're having are very key, and indeed, all what we've talked about affect well-being. But there's one critical aspect that we often tend to ignore, and that is the digital space. How engaging in the technology space affects your well-being. And for me, I do work, I'm recently got certified on Microsoft Digital Wellness. So presently I'm now beginning to consult on the same. So I feel there's need to have those conversations whereby, you look at things such as digital well-being, digital wellness, and the idea is to ensure and strike a balance between your well-being, your mental well-being, your physical well-being, and the digital space. Yeah, if I may just speak an aspect. So for example, there's one thing we call fabbing, and fabbing is a scenario whereby you're having a conversation with somebody, but you're on your phone. You've all been in that kind of scenario. So what does that do? It hits on your social skills. You can imagine, I'm talking to you, Lizzie, you're talking to me, Lizzie, but I'm on my phone. How do you feel? You know? And so on and so forth. So I feel there's need to have that conversation. And I'd be happy if it's possible to even have a section where I can speak in the upcoming conference at, I believe it will be at Tangaza, just to bring in the aspect of digital wellness. Thank you, Lizzie.
I mean, it has to happen. Collins, we already have a speaker, and this is very key. And I do know that Dr. Raymond actually brought it up in terms of new media, social media. I mean, that's where majority of the youth are, and that's where we have a lot of issues. And the digital space is not governed. It's still very gray on you know, like cyberbullying, what that actually means. When do you even know when you're being bullied? You know, so that is a critical discussion. And Collins, I hope you've taken note of the fact that this would be a good contribution during the meeting that's coming later on in the year. So we'll just dive into, because I do not see any other question or any other hand raised up. If Dr. Raymond, you can give us your input before we close with Magata, please make it approximately a minute short. Dr. Raymond, if you're still there. I don't think Dr. Raymond is there. So I'll just call upon Magata. If you're there, your closing remarks. Well, Elizabeth, it's your lucky day. They're both not there. So over to you, Elizabeth.
Oh, okay. Just maybe an addition in the PPC. I think we need to add mental health as in the performance contracting, the PC, so that you can have it as a target in every private and public sector, so as to foster more trainings, more sensitization, and also treatment, and also trainings of the TOTs to enable them to acquire more skills. Yeah.
That is well put. And I don't see the need of you know, like a whole country only having 100 psychiatrists. We can train as many, and we can use the community health workers also just tap into that, because they can pick this kind of issues if they're well trained and well informed. Well, we only have 4 minutes, ladies and gentlemen, so I'll hand over the program back to the organizer. Collins, if you're still there, I think this is where we're talking about the upcoming event, and this is something that everybody needs to put in their calendar. So Collins, over to you so that you can actually do the closing, and then we can call it a day.
All right, thank you, Liz, for this opportunity. Once again, I would like to thank speakers and also delegates who have dialed in today. Indeed, we have a need for PPPs, and I don't have much to say because I wanted to talk, but let's all make mental health a lifestyle in Africa, because it's this is one of the biggest challenge that we have currently, and it's affecting youth. And now there is a contribution of digital space, which have really done us injustice and justice. So how can we work collaboratively with relevant institutions to ensure that our youth are safe in digital space as well as in their real life situation? So that brings me to share about the upcoming event. This is going to be one of the engaging events. It's going to be as engaging as possible, touching on various issues that are affecting the youth. And I've shared the brochure in the chat space. Maybe you can get some time and familiarize yourself with it. This is going to be on 10th and 11th of August. So please save the date and come contribute towards building sustainable, healthy community for the youth. So I'll not talk about much of this, because really we need sponsors, we need exhibitors to come on board. Maybe you have a topic that you like to, a workshop that you like to conduct during the convention. Feel welcome, reach out to us through the contacts provided in the brochure, And also, I believe after this session, one of us is going to contribute, type our contact on the chat space. So that brings me in now to run for mental and physical health. This is my ask to people across the globe. How can we make a one-day run across Africa to let society know about this giant killer, which is really going or hurting or affecting young people so much? I think let's have a conversation about this and see how we can jointly make this day the run. Like somebody had mentioned, let's not make mental health, we practice only on mental health days or weeks or months. Let's make it a lifestyle. Each day, let's incorporate mental health in our workplaces. Let's incorporate mental health sessions in schools. Let's incorporate mental health sessions in sports sector, which is very big industry, and I believe we've been doing that for a couple of times, doing an awareness. But now, how can we make sure that we reach the right audience and large number?
Collins, your connection is not that great because now you've just frozen.
Okay, can you hear me now?
Can hear you.
You can hear me. Okay, thank you so much. All right, so we are planning this on 7th of October. You can come in as a strategic partner, as a sponsor, and we see on how we can roll this thing running. Or you can say, okay, we want to conduct this in our country, and on 7th, let's communicate to relevant people that we really need to work collaboratively to combat this mental situation that we have in Africa. So here is the contact. If you want to partner with us for the upcoming event, or maybe you have another project you'd like to share with us, or you like to participate in the upcoming run, or you would like to conduct a workshop during the convention, please feel free to reach out to us as soon as possible. So Mr. Robinson will guide you and help you with the kind of question and help that you need from YIDP. So I think that's all for today. I'll hand over to Liz now to give vote of thanks to our delegates so that we call it.
Thank you very much, Colin. We are exactly a minute past, but thank you very much to all the speakers. Thank you for all the delegates. And you know what, Doctor, all the doctors that have been here, all the comments that we've got, Elizabeth, I think this is an event that, you know, might be good for you to also give your input on this, but appreciate it. Have a great afternoon, morning, have a great weekend ahead, and looking forward to the next call. Thank you all and have a great one.